In this video, I want to discuss vitamin D in all the ways and why it is at the top of my list for supplementation for females in general, but most importantly, perimenopausal women between the ages of 40 and up, I should say. So women in perimenopause and menopause will really benefit. And this is a fat-soluble vitamin along with A, D, E, and K. And so that means that it's best absorbed when taken with a meal containing fat. So make sure, first and foremost, if you are supplementing with vitamin D, you are supplementing with a D3 and not a D2, and you are having it along with fat for absorption purposes. I find a lot of women are supplementing, but they're not supplementing with the right type of vitamin D in the right combination at the right time. So I want to go through all the specifics here today and talk about, some of the things that you might be experiencing if you do really need it. But at the end of the day, over 1 billion people in the US are deficient in vitamin D. It is the highest deficiency we have, and 50% of women at age 40 are deficient. So it really does show you across the board that more than likely you have some type of deficiency with it, ever so slight or severe. And so if you want to know for sure, have your doctor test you, of course. But I do feel that a lot of us used to be outside much more and more exposed. When you're a child, you're running outside every day after school with your friends, and you're at the pool every single day, and you're soaking up the UV rays, which is then converted to vitamin D in our body. And as we get older, our conversion capabilities is just not up to par like it used to be. And for people that do have darker skin tones, they don't do as well converting that UV rays to the vitamin D as well. So, depending on your ethnicity, depending on where you live, it is really going to be that much more difficult. And, considering our nutrition that we're consuming, it's really hard to get adequate amounts of the vitamin D through food and through sun. So when it comes to supplementation, the best form is going to be in combination with K2. The reason being is that our body does use this vitamin D to absorb calcium in our body. And if we're absorbing calcium because we have vitamin D, but we don't have the K2 to direct the calcium to where it needs to go, then that's going to be a problem, because then this is going to be sitting in our bloodstream and it can eventually calcify in our arteries, which is terrible for heart health. So we want to make sure that we are pairing the two together for ideal synergistic power, and we're not just, having the ability to do half the job, and then we're also putting ourselves in harm's way because we're not able to direct the calcium where it needs to go. So if you are feeling like you are getting ill a lot more frequently, maybe your recovery time is just not where it used to be, whether it's with your illnesses, your wounds, your infections are taking longer to heal, your recovery time in the gym is taking longer time to heal or to recover, whether you are just feeling a lot of brain fog, you're feeling a little bit more depressed, and it's coming more frequently than it used to, and maybe you're not sleeping well, maybe you're having a difficult time losing weight. All of these things do probably have something to do with your deficiency in vitamin D. And not to mention, as we get older, estrogen is declining, and so that puts us at more risk for fractures and osteoporosis. And so this is going to be crucial, again, because it's all tied together with calcium, our bones, and our brain health, and our heart health, and our metabolism, because we're reducing inflammation when we have a good amount of vitamin D in our body. So it's really the big picture here with vitamin D. It's not just one thing that it's helping with. It really helps with all the things. So again, you want to make sure that you are taking a good quality brand. I personally love the Adapt Naturals. It's in a tincture form in combination with that K2, and you just take a drop each day with a meal, but it's also there absorbed with the oil. So you're good to go regardless. And that is going to just be the easiest form, but you want to make sure that you stay consistent with the time of day you're taking it to keep blood volume levels, very consistent. And you want to make sure that you are consistent with taking it every single day. If you're starting supplementation with anything, typically it's going to take at least 4 weeks to even start noticing a difference. But for most people, it takes about 6 weeks. So if you're going to try something out for a month and then you quit it, then you're never giving it enough time. So really incorporate this into your day-to-day. And just know that this is going to help in the greater good of everything. Now, in terms of dosing, anywhere from 1,000 to 2,000 IUs per day is typically recommended. But again, if you want to know what's best for your body, then you can get your labs done. But if you do about 1,000 a day, that's probably going to be ideal for most people. If you're highly deficient, then of course you want to do a little bit more. So hopefully this was helpful, and we'll see you in the next video.